line coming in. I think, and it's not gonna be with. All right, let's get started. The committee meeting, our first committee is budget administration.
Bill number 151-24A, appropriation of $118,000. Commissioners and / human capital.
I can start it, and then Pete, you want to add to it?
If I need to.
Okay, it's $100,000 appropriation regarding an item in the handbook, a pregnancy leave benefit. And the benefit is for 6 weeks, $200 a week for employees that 1 to 2 years of service, and $400 a week or $2,400 maximum employees that have more than 2 years of service. So the estimated cost, we checked with Troy Scott, and he estimated a range of maybe 70 to 130,000 in cost. So we used 100,000 as a budget. Then add on FICA taxes of 7.65% and PERF of 11.2%. We checked it as eligible for PERF. So that results in an additional appropriation request of $118,850. We put it in the health insurance fund because it is related to women's health. Also, it's a way, the health insurance fund actually charges to other departments. So it's a way to recoup the cost from other departments. Happy to answer any questions you have on that.
Questions for the petition? It's in a big one.
Second.
Questions or consent favorably in a second? All those in favor say aye.
Aye.
All those opposed, same sign. All right, bill number 131. Great, goes to the full council with a favorable recommendation. Bill number 131-24B, appropriation of $136,329.29 in capital.
I can start it again. This is the appropriate, everyone, I think you're all aware of the different versions of the PTO policy, paid time off policy. And I think the group led by Pete Mullen and Courtney Mullins, I think they did a good job to try to accommodate employee concerns during the process. So the plan was modified quite a bit to kind of alleviate some of those concerns. We did a cost estimate on what the cost will be. And the total cost is estimated to be $136,329.29. That's a breakout. The actual payments to employees who will receive the payout will be $114,707. That's the estimate. That's an average of about $1,500 per employee. There's about 75 payments that will be made roughly. These numbers were going to change because these were done as of the end of November. And actually the policy requires it be done at the end of December. So these payments would be made early in February at the earliest. So there's this will change a little bit, but we tried to put a little bit of extra in here just so we didn't have to come back to you. We will if necessary, but we think this will cover the cost. So it's $136,329.29. It's a one-time cost, and it's going to be paid in the. You can see the departments that are going to be paying. The general fund being Fund 1000, some of the highway funds, and then the ESAP Fund 4930. So each fund was going to have cost. Any questions on that? And Pete's here to answer any questions on the policy itself. I know you've had a lot of stuff.
Question for the petitioner. I have one quick question for you. Is this total? What is this right around what you were thinking total would be when we developed this policy?
Originally, I thought it'd be a lot more expensive. We had other versions that were more 600,000, 700,000, but because of the way some of the plan was paid, it actually calls for less of a payout and setting up of an accrued sick bank for some employees. So it's a lot less than what I thought.
A lot less.
Quite a bit less.
Yes.
So I'm happy with that.
Yeah, so am I.
Seeing none, we have a motion. Motion to send favorably.
Second.
Motion and second sent favorably. All those in favor say aye.
Aye.
All those opposed, same sign. Bill number 131-24B goes to the full council with a favorable recommendation. President Lewis.
Next up is land use bill.
Yes, Mr. President, Bill number 128-24, rezone property located at 50415 Herbert Street. Petitioner UFP Real Estate LLC.
Doug Klein, Area Plan Commission staff with offices on the 11th floor of this building. So the proposed rezoning is for those 4 parcels highlighted on the screen. This is Granger, north of Adams. The petitioner is the owner of the large industrial property to the north and to the west, which is United Forest Products. These parcels, 2 of them along St. Thomas and Alice. They recently established a parking lot there. Once we became aware of this, we had to pursue it as a zoning violation since it was serving employees of an industrial use. It needs to be zoned industrial, which is what really motivated this rezoning before you today. Historically, this area has been single-family residential. However, in the past decades, industrial and commercial uses, as well as office uses, have been established here through rezonings. Such that there's really only 6 remaining single-family homes in this small residential area. To the north, again, is UFP, also to the west, and then to the south. You have some single-family homes immediately to the south, and then further south of Beckley, you do have those business commercial uses along State Road 23. This is the parking area as it appears, the larger of the 2. And then here's a smaller one that's historically been used. This parcel was rezoned to office buffer at some point in the past, and UFP did have a small office there with a small parking area. And then this is an additional property on Herbert Street owned by UFP as well. That's the entrance, right off of Alice and St. Thomas Street, just north of the proposed rezonings. Per the site plan, they're just showing the current uses as parking areas. Given the size of the parcels, they're really not going to allow any sort of primary industrial development. It would just be supportive uses such as the parking and related retention is all that's being planned there currently. Staff does recommend approval of the rezoning, and this comes to you by a vote of 8-0 favorable from the Area Plan Commission. In terms of the comprehensive plan, this area has been outlined as a traditional or transitional rather area where the conditions and the development patterns have changed over the years such that single-family residential is no longer considered the most appropriate use. Additionally, this particular area is targeted for infill and redevelopment. Looking at the current condition and character on these particular parcels, they just contain the parking areas, and then the one contains a fence. In terms of most desirable use, given that they're now surrounded by industrial and commercial uses on all sides, it's no longer deemed the most desirable use to have single-family residential in this area. Rather, industrial and commercial infill, which can take advantage of available sewer service, seems to be the most desirable at this point. In terms of conservation of property values, there are still 6 single-family residences, as I mentioned. However, given the size of the parcels, they're really, until potentially more residential parcels are acquired, these are just going to service parking and not intensive industrial uses. Finally, responsible development and growth. It was found that future industrial use in close proximity to an established industrial use, which potentially has access to sewer in the future, would be the most responsible use for this property. Again, comes to you 8-0 favorable from Area Plan Commission. No one spoke in favor or in remonstrance. Happy to answer any questions you might have.
Any questions?
For the petitioner, so is the long-term plan to use these areas as park? That's a long-term plan?
Yes.
Petition. And then I'm just curious, that the homes that dot this area, it is being developed. A lot of industry around those homes. Just curious, are those homes rentals? Are they owned by people? I know you wouldn't know that, but
This question did come up during the area plan, and in looking at the property records, 5 of the 6 had owner addresses that were identical to the property address. One on the east-west street to the south had an Adams Road address as the owner address.
so they are, that would indicate that at least 5 of the 6 are owned by people.
Petition, do you have anything to add?
If, have any questions for us? Appreciate staff's help through this process as we own correctly for these areas so they can continue operating. Thank you.
Any other questions? I'd like to entertain a motion.
Motion is favorable.
With motion sent to everyone, second, all those in favor say aye. Aye. Opposed, motion passes, full council. Favorable recommendation. That's all I have, Mr. President.
Thank you. Next up are Bills Building Committee, Board of Human Services, Criminal Justice Committee, Mr. Ritter. Yeah, you're the bill book. You held, right?
No, it's, oh.
It was just.
It was.
It was.
Bill number 120.
Okay, so what we have here is currently our county regulations require that a pool that is 2,000 square feet or larger in surface area have a lifeguard. I got a call from Senator Rogers and also from the gentleman who operates Woodwood Country Club. Their pool is 2,461 square feet. They have a really hard time getting lifeguards. And they wanted us to see if we could change the regulation from 2,000 square feet to 2,500 square feet. I did some research to help Mr. O'Brien, Health Department attorney, and discovered that according to pool regulations 410 IEC 6-2.1-25, section 25 says this rule may be administered by the department or by the local health officer through their authorized agent. So the rule can come to the county and the county can basically decide whether they're going to follow the state rules or going to have a different rule. What we currently do is follow the state rule in order for the gentleman to be able to run his pool without the lifeguard having to be there. We would have to reduce or increase the square footage from 2,000 to 2,500 square feet in order to run the pool without a lifeguard being there. I did some research into drowning deaths, and it's really a little bit concerning. You don't have a lot of data on drowning deaths in the state of Indiana. They are divided into bodies of water, and most of them happen in ponds and lakes. I think we had 4 in the last 4 years in pools. So they asked me if I would bring this forward. I said I would. I didn't see a problem with it. I spoke with the gentleman after Mr. Tanner had some questions. I spoke with the gentleman who runs the facility at Knollwood. They do not serve alcohol in the pool area. That he said that doesn't mean that someone doesn't walk in there with a drink, but he said that is not the norm. So I don't think that's a concern. And so in order to allow him to run his pool, because without a lifeguard now, he can't even run the pool. They have a horrible time hiring lifeguards, as a lot of people have a hard time hiring people now. I did tell him that I would probably, working with anybody who has suggestions, if we take this to the full council on the floor, I think we need an amendment to it that requires some signage that lets people know, there won't be a lifeguard on duty. You're going to have to really keep an eye on kids. So that's basically the regulation change, the requirement from 2,000 square feet or more, requiring a lifeguard to 2,500 square feet. Pretty simple. Questions?
Dan, or actually,
Yes.
sorry, I should ask the chair. Thank you, Mr. So my question was about the consumption of alcohol, or more specifically about the sale of alcohol on the premise, but I think it is broadly concerned is the consumption of alcohol there. Not because I expect that youth will be consuming alcohol on the premises. I think that's who we're more concerned about for the potential drowning, but truly it's about oversight. It's about responsibility, it's about your safety. And I know this may not be the only facility that in the future has challenges with hiring lifeguards or enough lifeguards to fully staff it for our operating hours. I did ask that question. Thanks for identifying that. In addition to the sign amendment that was proposed, that may be written and authored and presented at the public hearing, I do think that something regarding the sale or consumption of alcohol on the premises would be appropriate. If
Within the indoor pool.
within the enclosed pool area, because I imagine every single one of these has some kind of a fence or enclosure, whether it's a public or semi-public pool. There are other country clubs, there are other facilities, there may be some HOAs that still operate a pool. I'm not sure if there are current or future plans to sell or allow alcohol on the premises, but if there isn't going to be a lifeguard, then I think we as a community should ensure that the parents, the adults who are present, should have their complete wherewithal to supervise their children. That's just my initial instinct. I don't know what that language would look like, but that's my initial concern. And if this were to pass, then there's at least that additional provision.
Question.
Not on your committee, but thank you for recognizing me. Dan, so state law, the state's 2,000 square feet now, it's,
These are the state pool rules.
okay,
However, the rules, that section I read you,
right,
allows the local health department to divest from these rules.
okay. Would this rule apply to other municipal appropriate areas since the health department? I think the health department regulates all public, semi-public pools.
My understanding would apply to any pool in the county that fits within the square footage.
Doing some math, I mean, that's a pretty big pool. Start doing the math on what size that is. That's just square footage, right?
Yes.
Yeah.
Surface square footage, 20. Their pool is 2461. Yeah, I agree.
At
Pretty
Noldwood?
decent. Yes, and I have not been in the country club. Experience that.
Do we know that, and this would not preclude something, I'm guessing like, if I own a club or I manage a club and my insurance carrier knows I have a pool, I wonder if the insurance carrier is gonna demand something more of the facility. They can do that. This won't preclude them from doing that, right?
Oh, sure, I can, I would refer to our legal counsel, but I would imagine that the insurance company would require pretty much what they
Typically
want.
a contract between the owner of the pool and the insurance company and.
There's insurability or something.
Yeah, and yeah, it could impact insurability, could impact the cost of insurance. And this is, the terminology is semi-public pool. So when you say the municipal pools, I don't,
Well, I forgot, in municipal areas, I'm thinking like a Scottsdale Community Pool, Morris Park Country Club, they're in the city of South Bend. But yet they're not municipal pools.
right,
Clubs, neighborhood.
municipal pools.
Yeah. Mishawaka have some others too.
Scottsdale, going.
There's another one down there.
Wickenham Pool,
Or Twin.
there's Swanson.
That,
Swanson.
thank you.
I know this one kind of puts me, this is tough because I'm not just talking about this young lady that don't, but I hate to make a decision based upon any owner having trouble hiring somebody. Because do we really know how hard it is to try? I know post-COVID, it's hard to find people. I get that. But I just hate to make a decision based upon him not being able to hire someone. But on the other hand, just because it's a larger pool, I don't think that changes the probability of somebody drowning. I mean, they could drown in a small pool if it's deep enough. See what I'm saying?
Well, it wouldn't apply just to him. It would apply to any.
No, I know that. No, I know that. That's what I'm saying.
It
I
is
mean, if you
helpful.
don't have if you don't have a lifeguard at a smaller pool, it's got a deep end, you can drown there. That's my point.
I used to for a long time. I don't think they've ever had a lifeguard there. Gone to their attention that they weren't in compliance for their inside.
Oh.
And so for the 10 years that I've used that pool, they've never had a lifeguard.
Okay.
And they do have, like, my memory is that they have things posted.
Okay.
And so I think maybe because someone.
Gotcha. Okay. I'm glad you said
Some
that.
historical background.
Okay,
There's
thank
not a bar inside.
Okay.
Pool area. There's a dining room down.
Okay. I'm glad you said that. Thank you.
People bring.
They don't know if they were doing maybe. I mean, it's not typical.
No, I
I mean,
think
there's also an inside pool and at the outside pool, they have lifeguards, but people head out there.
Thank you.
Think
Yeah,
there's
okay.
a-
Okay. Yeah, that's good. That's good insight.
So, just to clarify, is the challenge with the lifeguards at the inside pool, but
Right,
not
the outside
the outside
pool.
pool during summer when it may be available to youth or teenagers, so college students only in pool, higher, so it's, the problem is the indoor pool.
So he doesn't have a problem hiring people for the outside pool?
It's a different scene, right? Like the outside pool is very busy.
No, I get that. So I guess what you consider the lifeguard punk if you're on the inside? No, just kidding.
I would think, I would think for several grade.
It's just a different.
No,
The girls have done it. It's very busy at the outside pool. The inside pool is not as busy.
Right.
A lot of times just classes going on, like teachers doing swim lessons. There's people that come in and do laps.
Okay.
It's not the same enthusiasm as the outside pool.
Same song.
There's 3 different pools outside, so.
Just wondering if they're smaller and they're really. Check.
I would say my concern isn't necessarily this exclusive reason that may warrant some consideration of a change or some kind of accommodation. But what are the unintended ramifications? Does it allow somebody else who's maybe a well-intended good actor, but does they loosen their typical operations because we allow them to, and we're put more people at risk? I wouldn't think that extra square footage is that substantive of a difference, but again, there are a lot of factors in play, especially for those pools that either allow the carry in of alcohol, maybe don't allow it, but it happens regularly, or some of the semi-public or private pools that do allow or sell alcohol poolside. I hate to get into a situation where they don't have a problem now because they do staff the lifeguards, and we suddenly create a situation where they don't have to staff the lifeguards, and therefore they stop. Issue elsewhere, not to say that we wouldn't have to know, but the specific problems that they have, because I don't know of any other, that could be wrong, any other country club or otherwise that has an indoor, they might be doing only one.
Wouldn't that question be answered if you find out how large
Yes.
pools are? I mean, that's a good point, right? But it sounds like, what, outside you said is the hot spot? Okay. I don't think that's gonna change, because it's hot, it's gonna be hot.
Indoor pool, so obviously, you're gonna use that in the winter, and not so much in the summer.
Your health clubs like your Rock Center and your Moral Health and Lifestyle, Beacon, Granger, and indoor pools.
That would absolutely apply, because I'm sure they have a lap pool, and as soon as you got that kind of length, you're probably gonna have that kind of square footage.
They have lifeguards at Beacon.
Is there another definition? I know we're calling this a semi-public. Are there defined requirements for public pools as well compared to semi-public?
Yeah, if you go through the rules, there are, so we go through section A, they've got a B and a C here. semi-public pools on the premise of a tourist home, semi-public spas on the premise of a tourist home, and they have different classifications here.
I just saw the cover. It says it's for public and semi-public.
Yeah.
On that cover there. Yeah. They kind of categorized. They're the same umbrella. I wonder what defines it.
Ownership or.
Restrict it in that sense, you know, for sure.
I mean, changing the ordinance legally is the county. To see if something bad happened, the county changed the ordinance, how is this liable for the county?
Yeah, that. I
Is
think
that not,
I think that's a real stretch. Doesn't mean
Okay.
someone couldn't claim.
obviously, they're gonna have their insurance.
Can I make an observation about Mr. Tanner's observation? So with regard to not wanting unintended consequences, if you're thinking about adding amendments, maybe the amendment does something like for pools between 2,000 and 2,500 square feet, then if they don't have lifeguards, then no alcohol, and make sure the signs are posted. So anyone who is below 2,000 who doesn't need a lifeguard already, suddenly they're not brought into that. And I can email you that, Dan, if you want.
Other questions? Your motion?
I was gonna say without recommendation, depending.
Motion sent, am I your committee on? I'm the committee?
You are.
I hope so.
No, maybe you're not. I don't,
No,
Okay.
on
there
Amy,
you go, Brian.
Thomas and Catanzaro are not on that. committee.
I will.
Let's try that.
Okay, all the-
I.
What is that?
Okay, so bill number 1/2024 moves forward with a,
With budget administration, but that bill is being held in committee, so we are officially done. Merry Christmas, everybody.
Merry Christmas. Don't have any